good afternoon, and good evening to all of those who have joined us. And it's lovely to see those of you who have your cameras on, lovely to see a few familiar faces, and also great to see some names that are new to me. So, for our Global Cafe regulars, you might recall that I was a guest on Global Cafe just a few months ago and earlier this year, and I've now joined you as the Chief Strategy Officer of the IFA. And today, it is my pleasure to introduce Ms. Kylie Shae, who is an occupational therapist from Australia who has worked in disability and international development since 1991. Kylie has a very rich set of experiences that we will hear more about today, but as a preview, Kylie founded Motivation Australia and led the organization for 13 years. As an accredited partnership broker, her work with Motivation Australia provided an opportunity to collaborate and work closely with colleagues from across the Pacific region and contribute to a collective approach to build sustainable rehabilitation and assistive technology services in the region. And in 2019, Kylie was awarded an Order of Australia Medal for her work in the Pacific. The Access to Assistive Technology team at the WHO that Kylie now leads is responsible for operationalizing the 71st World Health Assembly resolution on improving access to assistive technology and mobilizing the global assistive technology sector through GATE, the Global Cooperation on Assistive Technology. And if that's not enough on her plate, Kylie is also pursuing higher degree in research at Flinders University, Australia. So welcome, Kylie. That was a lot, and I look forward to hear more on all of these areas.
Hi, good afternoon from Geneva, but good morning to those of you who are over in the States, and whatever time of day it is for everyone else that's joining the call. It's a real honor to be here. And I do want to say thank you very much to Cynthia, whose idea it was that I join and participate in the Global Cafe. And also hello to Sylvia, who I have the great pleasure of having worked with my team at the moment as a consultant, but I think she's a very familiar face to many of you. And I also see a familiar face on here. Hello to Jane, who's someone that I've worked with before, but it's a real pleasure to meet everybody, and I'm looking forward to having a conversation. And I love the idea of a global cafe style of getting to know you. Back to you, Sonia.
Thanks, Kylie. This is a conversation, and as you've heard, we crowdsource our speakers. So if you have great suggestions, please let us know. We always want to meet new people who are experts in areas that we may not be aware of. Kylie, we want to start on a personal level. We want to learn more about you. So can you take us on a bit of a journey, both professionally and personally, on how it led you to where you are now?
Thank you for the question, and I feel like a lot of that was covered in my my bio, which was longer than I expected, but thank you. So yeah, I am an occupational therapist, and in terms of how did I get from being a young occupational therapist in Australia, back graduating in the late 1980s, to where I am now, sitting here in Geneva and responsible for the program on assistive technology at WHO. It has been a journey. I actually began my professional career working as a pediatric occupational therapist. So I find it quite ironic that at this stage in my career, supporting the needs of older persons has become a real passion. But working with children was when I first really understood the importance of assistive technology as an enabler. So working with children with severe and multiple disabilities and understanding that if we were to be successful in giving those children an opportunity to participate equally with others, we've really needed to sort out fundamentals like the right wheelchair, the right postural support, opportunities for them to be able to communicate, ways for them to be able to sit safely and to eat without fear of choking, these kinds of things. And that was the bulk of my work, was really trying to work out good quality assistive technology that enabled those children to be as independent and active as possible. And very soon in my career, I understood that what we were doing in Australia within the services that I was working in was actually quite, it was a luxury, and it's not a luxury that shouldn't be there. It's a right, in fact, but in many, many parts of the world, access to those kinds of services is absolutely absent. And in the early 90s, I think many of you might remember some of the stories that came out of Eastern Europe of children that were living and growing up in orphanages, and many of those children were children with disabilities. And so that's really what captured my heart into international development. And I'm not going to go into the whole journey of how I got, that's 35 years worth of, going and working in orphanages in Eastern Europe to here. But suffice to say that that led me on a path of international development and really understanding the value of my occupational therapy training, the importance of assistive technology, a real passion to make sure that that's equitably available for everyone who needs it. And then to be working at this level where my role is to support good quality technical guidance and advice to countries to strengthen their systems. And then maybe just a little bit on a personal note is it's supporting and caring for my own parents has made me much more aware of how critical it is that assistive technology is available throughout the life course. And the experience of supporting my father in the last 6 months of his life and his rapid need for assistive technology, and how hard it was even for me as an occupational therapist in the Australian system to be able to access those services quickly enough. And then having conversations with colleagues I work with in low income countries and their experience caring for their parents, and understanding that for many, that access doesn't get there at all. It was a little late for my father, but we got there. And for many people, they are not able to access it at all. And so that's something that I've become really interested in dealing with as a part of my portfolio of work. There you go. That's
Thank
kind
you.
of a little bit about who I am and why I'm here and what catches my heart. Thanks, Sonia.
Thank you for sharing that. We have, from since we started this global cafe, used the term assistive technology a number of times, but we haven't
Mm.
actually quite yet defined what that means. So, Kylie, from your perspective, from WHO's perspective, how do you define assistive technology?
Thank you. And it's a great question. And it's a confusing answer sometimes. Assistive technology at WHO is an overarching term that we use deliberately to talk about the assistive products. So they're the devices that we hold or use and call assistive products. But assistive technology encompasses also the services and the delivery part of ensuring that people have access to the product that fits and works for them and meets their needs, and that there's follow up and repair and maintenance. So all of that encapsulated, including the policy that needs to be there, et cetera, is all in under the term assistive technology. And then there's another confusion in the definitions, because people often say, well, what's an assistive product? And we're very clear about that. But I don't know that the definition really matters in a conversation like this. It matters to us technically at WHO. If I'm asked to develop a priority assisted product list, technically I need to include assisted products and not other things. But often they merge together. So I'm talking about, an assisted product versus something that might be a therapeutic product, something that really helps in terms of your rehabilitation. But an assistive product, by definition, is something that you are using individually yourself. It's not an accessibility mechanism. It's a product that you're using yourself that is there because there's some kind of functional impairment, and you're using it to compensate or to prevent that functional impairment to become exacerbated. And that is what an assistive product is. There's lots of them, but that's the definition.
Thank you, Kylie, for that distinction, which is actually new to me. So I appreciate that clarification of that, of the terminologies, because we will be using that through the rest of our conversations, I imagine.
Mm.
What do you know? You already mentioned a little bit, Kylie, around for your personal experience, and then in talking to colleagues in LMICs, in the difference in access. So what do we know globally around the statistics of assistive technology? Who has access? Who doesn't? How many people are require them? How many people are using them?
Yeah, thanks for the question. And I think this is a really nice time to just drop in the chat a link to the global report on assistive technology. So, just in terms of a little tiny bit of background, WHO launched for the first time or adopted a resolution on assistive technology in 2018, which was the first time that we could really say that WHO has a mandate, which is given to us by the member states, by countries, to really work on this issue. And within that resolution, there was a request to WHO to prepare a global report on assistive technology. And that took us 4 years because we did an awful lot of data collection and research and consultations globally to really understand the picture. And it's that document that I can now quote from in order to give an answer to those questions. So, in terms of how many people need assistive technology, we estimate that in the general population, at least 1 in 3 of us uses assistive technology. Now, a large number of that, the largest group, is people using glasses or contact lenses. So I rely on contact lenses and I used glasses since I was 3. And they are absolutely an assistive technology to support people with vision impairment for different reasons. And if I hadn't had access at the age of 3, then I would be a child with a learning difficulty. I wouldn't be where I am today. And yet we know that many people in the world do not have access to simple refractive error glasses. So that 2.5 billion captures the whole population, 2.5, 1 in 3 of us. But the really important factor that I want everyone on this call to remember is that when we look at the population over 60, it's 2 in 3 people need at least one assistive product. And then as you age, rapidly start to use more and more assistive products. And so we are talking about the largest group of people that use assistive technology are older people. And that may well be people that have used assistive technology all their lives. So someone who was a wheelchair user and became a wheelchair user in their 20s from a spinal cord injury, for example, as that person ages, they're going to need, like the rest of us, reading glasses, potentially hearing aids. Plus, the wheelchair that they use is going to need to adapt to their body as their body changes. So that's one group of older people. They're lifelong AT users, but their AT needs are becoming more, I would say we need to be more responsive and we need to be quicker about our response to their need for assistive technology to ensure it continues to meet their needs. And then we have people who are aging and are starting to need assistive technology in order to maintain their function. And that's the sort of hearing aids, glasses, walking sticks, walking frames, grab rails, toilet chairs, shower chairs, these things that are really, really important for people to be able to continue to be as active as they would like to be. And then all of us, if we live long enough, start to face that situation where we're needing care and someone needs to help us. And then assistive technology again becomes really, really important to enable that care effectively. And it helps people to stay in their homes if that's what they want to be able to do. So it's given you a little bit in terms of the statistics and then how it's important for older people. I think the key thing there in terms, the last statistic I want to share with you on access is the inequity piece. So we know that in lower middle income countries, the access rates are sort of on average around 10% of people that need assistive technology are actually getting it. And in some countries, that can be as low as 3% of those that need it. And the thing that's important to understand is the barriers and the reasons why people do and don't have access are similar to some extent, whether you're in a high or a low income country. They're just exacerbated in a low income country. So, issues of finance, the fact that the systems aren't prepared, that there's not a workforce, that there's low awareness on what assistive products could assist. And so those sorts of things are really impacting most in low income countries. But it doesn't mean that we're getting it right in high income countries. And my own experience with my father really brings that home to me.
Kylie, you mentioned just now around human resource, which I think typically we would not think about within the lens of assistive technology. And I know that WHO has this fantastic 5P framework.
Mhm.
Could you walk us through that and how that all fit together?
Yeah, thank you. So we have the 5P framework is something that was developed back in 2014 by a whole group of people that came together and were convened by WHO around this initiative called the GATE Initiative, which is Global Access to Assistive Technology. And what we were looking for was a framework to be able to capture the many different actions that are needed to address the different kinds of barriers that I really just briefly touched on then. And we wanted also a framework that spoke to everyone and wasn't just a health systems framework, because assistive technology, crosses across many sectors. It's relevant to education, to social welfare, to labor, to aged care services that may not sit within health, etc. So we wanted a framework that everybody could see and own and see their part in it. And the framework ended up working around these 5Ps, which makes it very easy to remember. So we put people at the center to begin with, because essentially everything needs to wrap around the individual needs of people. And it needs to take into account people's preferences, the choices that they want to make, their autonomy, making sure that any solutions that we are coming up with collectively are responding to people's real life needs. So that sits in the middle. And then around the outside of our framework, we have 4 areas, each of which is equally important. And if you do action in one, you will generally see that you need a corresponding action in the other. So the 4 Ps around the person is policy, which includes policy, governance, and finance matters. It's products, so we know we need the products. And then we need provision systems. So we need that kind of service delivery mechanism that helps people get the products that they need safely and with the supports that they need. And then to do all of that, we need people, we need personnel, we need the workforce. And I'll give you an example of why we can't act on 1P and expect to see a perfect result. We have to do something on everything. So a little while ago, we ran training for primary healthcare personnel in Tanzania. And in Tanzania, the training that we delivered was to people working in the health system at the community and the primary health level who are working with a broad community, but we taught them how they could identify when there's a need for an assistive product amongst the community that they serve, and how they could provide a selected range of simple products like hearing aids, toilet chairs, walking aids. And that this program was actually targeting older people and really trying to help older people that are coming through the primary healthcare service in that particular province. So we ran the training, we provided the products, we worked with the Ministry of Health to put the products through their procurement system and so on. So we're working on the personnel piece. We worked with the ministry on the provision piece around the system and bringing the whole province around this program and making sure the primary healthcare centres were ready to deliver the services. And we worked on the product piece. We procured products and the products were put through a supply chain mechanism that is part of the health system in Tanzania. But when we ran the training, we discovered that there was a policy that had been developed at the national level in Tanzania that people in primary healthcare or community health are not allowed to provide glasses because it's outside of the scope of their practice. So that's a policy decision. And it was made in order to make sure that people got the right eyeglasses with a proper assessment by a trained optician. There's no reason why we can't provide reading glasses without a trained optician. And so the policy became the block. So we needed to then go and change the policy and have the conversation with all of the eye care people to change the wording to specify which glasses have to be provided by an optician and which glasses could be provided safely by primary healthcare personnel. So that's the framework, and that's one story about why we have to think about all of those Ps in order to be able to have a successful result when we're implementing change.
Thank you, Kylie. And I do see in the chat, I appreciate that we are assisting each other finding resources. So if you are looking for a diagram of the 5Ps for reference in the future, it is in the reports, in the links together. So please, you can look at that. And Kylie, you already mentioned that was a fantastic example around the training that you were providing to personnel. Can you share more around the training that's been developed at the WHO around assistive technology, around the 5P framework.
Yeah, for sure. I mean, one of our program essentially has actions across all of this framework. And one of our main activities under the personnel P has been the development of an online training tool called TAP. And I should have prepared a link for you for that, but Sylvia might be able to grab a link for me so that you can all jump on and have a look if you would like. And it's actually very relevant for anybody, whether you are someone that would like to be able to provide assistive technology at the primary healthcare level, or if you are someone that is interested in knowing a little bit more about some of the simpler assistive products and how they can be used. There's a whole wealth of resources within this platform. But essentially, what we really want to do is remove some of the access barriers that are related to the distance to service for many people. In many lower middle income countries, assistive technology is really only available within urban settings. And in the health system, it's only at the sort of secondary, tertiary level. Whereas there are really simple products that can be provided with reasonable competency-based training, and we want to make those available, ready to go at the primary health centres, which is the front line of health services for many, many people. And in particular, when I think about an older population, access to things like walking aids can really help to prevent problems occurring, such as falls. Nobody wants to fall. And when you're older, you really, really don't want to fall because that can really set off a cascade of all kinds of health complications. So the TAP platform has been designed to help governments to roll out training in awareness about assistive technology, how to identify, how to refer, but then also how to provide a selected list of priority products that can be safely provided at the primary healthcare level. Work with governments to help implement that training. It's online, but it is hybrid. So you can go on and access all of the resources, but we aim for governments to be running it with local mentors, making sure that the staff are actually receiving mentored practice and supervision so that they really do achieve the right competencies to be safe. Because at the end of the day, we don't want anyone to be harmed by an unsafe prescription. So we do that, but then also, as I said, it's a nice resource for people to jump on and just learn a little bit more for themselves. And if you do go in, you might be able to see my dad. He is actually a very willing video participant for quite a few of the learning videos, and was also extremely open about sharing his experience of using incontinence products, and has given a really nice personal testament to how helpful they were for him when he was still going out and about, but really needed that extra support. So yeah.
That's fantastic. I'm glad that he was able to participate in that. That's really great.
Mm.
You also mentioned, it is very interesting. I find that you mentioned assist technology almost as a preventative practice as well. And so I find that sometimes we think about assist technology as something that comes in after a fall or after someone has been in an acute care setting, but it really very much is a health promotion tool as well.
Mm. Absolutely. And so often we're missing that opportunity to utilize assistive technology early. And I do know that a lot of people are reluctant. My mother is doing really well, mobile, et cetera, et cetera. But if I talk to her about the fact that, don't throw away dad's walking stick because you might need it. No, I'm never going to need that. And my mother's neighbor was really reluctant to start using a walking stick and has now started to use one and is talking about how incredibly useful it is, and she feels much more stable, etc. But there's a reluctance, and I understand it, and certainly talking to my mother, I totally understand. She really wants to continue to be as able and to be seen as able. She
Mhm.
sees holding that walking stick as being something that might indicate that she's not. So I totally get it, but at the same time, I really want to say to people, want to prevent those falls if we can. And there's other preventative aspects of assistive technology, such as many wheelchair users, for example, are at risk of developing a pressure wound because of the hardness of the wheelchair. And, we always want to see people using a cushion when they're using their wheelchair. Certainly people with loss of sensation, but also people who are older, because the skin is frail and it's very easy to get a small tear or a
Mm,
red mark. And so
mhm,
using a cushion, even if it's a bit of a pain to move that cushion, and to carry that, and you fold up your wheelchair, but you've got the cushion as well, but it prevents problems from occurring.
mhm,
Yeah.
mhm. Yeah,
Mm.
absolutely. You talked about a number of products and also the training around products. Can you talk more about the priority assistive products list and how that came about, how people are using it, how governments should be using that?
Yeah, exactly. So again, that's another one of our tools. So we've got the TAP training and platform for our personnel. And then in under products, we do quite a lot of work in helping governments to work out where to start. So if we think about those countries where 3 to 10% of people have access, these are countries where the health systems are not yet prepared. They're not procuring assisted products. There's not financial mechanisms in place, such as health insurance that list assisted products. Government health benefit packages don't include assisted products. And then countries will come to us and say, where do we start? And so the priority list was born out of that request, and it models against the essential medicines list, which maybe, I'm not sure, it'd be nice to see hands up if anyone's heard of the essential medicines list that WHO has managed now for 50 years as a really important tool for particularly low and middle income countries to make the selection around which medicines they are going to make sure are available as a priority when they're budgeting. So we worked with that concept and developed the first list, which was 50 products, and that was launched in 2016. And within that, there are products under the different domains. This is something people don't think about. Assistive technology can support in helping people who have got challenges with thinking, so cognition, challenges with communication, challenges with mobility, which are very commonly recognized, also challenges with hearing, challenges with vision, and self-care is the additional one that we've put in because it is so important. How do you get to the toilet safely? How do you feed and how do you eat? How do you drink safely if you're a child with cerebral palsy, etc. So self-care is really important as well. So within those 6 domains of products, we had a short list and there was a lot of consultation and we developed that priority list. And I know Jane on the call was one of the people that was at the final consultation for that list back in, I don't know, maybe 2015. So since then, at least 22 countries have established their own national list using that priority list as a basis. So it helps countries to fast track a decision-making process because there's already been that kind of WHO evidence-based guidance provided. And then the countries are able to say, right, we now will have a consensus process and discuss with all of the stakeholders what are the most important products that we need to be focusing on. And once they've got that list, they can start using it in order to build procurement, to be able to look at which of these products can be brought into our health system. What workforce do we actually need? If we've got wheelchairs on the list, do we have capacity within the health system to carry out wheelchair assessment and prescription and follow up and maintenance and repair? Hearing aids are on the list. Do we have enough audiologists? Do we have enough hearing aid technicians, etc.? So it's a really important starting tool for countries to know, what's most important to the citizens in our country and how are we going to plan to provide that. We are doing an update at the moment. And so this is a really nice opportunity to let you all know if you're interested in having a say on the next update to the priority list. We have consultations happening in every region and globally. So there's 1 global consultation and 6 regional consultations starting from Monday. And they're open consultations. Anyone can join just to register in advance and then hear what the update list is and then to make comments and confirm that we've got it right. It's been a year and a half in the making, so I really hope we're very close. But the reason we're doing this consultation is to make sure we haven't missed anything.
Fantastic. And I see that Krizia has preempted all questions in the chat around how to access the consultation. Thank you so much. That was going to be my next question because we do have a question around how do civil society individuals and other groups representing older persons engage in the work that your team is doing, Kylie, around assistive technologies? And I know there's this consultation. Is there other opportunities for people to engage?
Yeah, absolutely. So one of the things that we would really encourage is if you want to become a member of the GATE community, and I'm very happy to see that Chrissy is on the call because she can drop the link on how you become a member of the GATE community into the chat. So thank you, Chrissy. So that's one way. And through that, we send out an update. It's a quick roundup once a month of some of the key activities. Often they're activities that we're involved in and some of our partners. But I also am really trying to have any member of GATE to tell us an update, something that's happened in the month that they think is really important that others globally might want to know about. So that's there. We're also
Mhm.
always really happy to receive individual queries. And so Quizia again can drop in the chat the email address for our team. And we have just recently received something from someone that can't attend the priority list consultations, but is really passionate about a particular product group. And they've sent a message through that way to just say, we just want to make sure that this is being discussed. And so then I can reassure and say, actually, yes, that particular product group is very much on the list and being discussed. And so that's reassuring for them. And then the other way that I would really encourage is actually through, for this group, is through IFA. The WHO works really closely with different partners. IFA is in official relations with WHO, which makes an ideal platform to capture what your membership and participants and the people that are really engaged around the priorities of IFA to capture those and then bring them to us in a coordinated and consolidated way. And as you know, Sonia, when we met recently in Geneva, we talked about different ways that we could be working together. And so, for us, it's really important to have platforms like this that we can engage with. And so for your members, knowing that you're in communication with us is also another way. So there's three different options. Yeah.
Yeah, thank you, Kylie. That's fantastic for the different direct options. And also, thank you. Absolutely. Through the IFA, we work very closely with the WHO. There's also a number of new ways in which we could be exploring. So please do let us know and we can just dialogue together. Back
Mm.
to the product list, you had talked about procurement, Kylie. So I want to invite Cynthia. Cynthia, if you would like to unmute and actually share about your question that's in the chat, a very excellent question around the procurement of these products.
Well, first of all, thank you, Kylie, for joining us on our global cafes. But it really comes out of my own background in sense vision and hearing loss, uh, where products are developed, beta tested, but not beta tested with older persons. And age
Mm.
appropriateness is correct across the lifespan. But often what I found was, oh, yes, we have to retrofit this to make sure it's really, or even just the directions for use are not available, for example, in larger print or in Braille. And it's often the case of you're going back to the product developer and saying, this product is really good, meets a need, but it's not always accessible because of the comorbidities for older persons. And I just wondered if in the four P's and you are able to back that up so that product developers become more aware and inclusive at the development beta testing area for what are the common um, comorbidities for older persons.
Thank you. And there's a bunch of things in that question, actually. So it's a really, really good one. And I'm just going to work backwards. You talked about there's some really specific challenges around the product use that older people are facing. And this is why we need to have more of these global cafes, because I need to hear more of this. So you mentioned the accessibility of instructions. And I think that that's a really, really important point. I mean, one way that we do address that in our work is through our assistive product specifications. So backing up the priority assisted product list, we have a document which has 26 of the products from the 50 and specifications for each product. And when you develop procurement specifications for any product, assisted product or any other product, very often it includes what kind of instructions are expected from the manufacturer. Now, I would like to go back now after this call, and I'm going to check those specifications to see if accessibility of instructions that come with the products is considered. I mean, if broad accessibility is in there, which I think it possibly is, the next thing is to cross-check, well, does that actually meet the kind of accessibility requirements that you just mentioned? So, you know, that's an in and that's an opportunity for us to address that. But I think what's important is we need more feedback from older people who are users of assistive technology, making sure that this is really clearly spelt out and that, you know, people in my role make sure it flows through to our work, but then also industry is responding and understanding the strength of the market of older people and realizing that the more that they meet that market's needs, the more we're likely to see, you know, take up of the assisted products, but then also that's good for them in terms of more products sold, which does matter for the market. So that was on the accessibility and the instructions. But in general, you were really talking about age-sensitive products, but I would stretch that to age-sensitive implementation and service delivery as well. And when it comes to the sort of age-sensitive products and services, one of the pieces of work that we're working on at the moment is a global roadmap on universal access to assistive technology. And that was, you know, just recently, and I'm sure you participated in one of those consultations, and that was something that Sylvia ran, was the consultation on what are the particular needs for older people across the 5 Ps. And we deliberately ran that consultation in order to feed into the global roadmap. It'll be at a high level, but those kinds of triggers. And the term age sensitive is something that we've not really been using that much in our writing on assistive technology at WHO, but we are now, after really listening, picking that up, and it will come out clearly in the roadmap. And it's a very high level document. So it's like 2 or 3 words is, you know, what we have to work with, but really flagging when we're talking about service delivery mechanisms, saying that these need to be age sensitive, and then unpacking, well, what does that actually mean? You know, and for me, and I would love to hear what people have to say, age sensitive means for older people, because obviously it's relevant across the life course, but for older people, I think it's about being timely. Older people don't have time to wait. We need to be moving swiftly. It means distance to service, I think, is a really important thing. And I know of, you know, older people that are busy going from one appointment to another, to another, to another, all different sort of services, rather than things being more integrated and then also closer to home so that they're more accessible. I think also addressing this issue of stigma and really understanding that why would an older person want to carry some ugly piece of equipment and they're already not sure about whether they really need to be using it and it's really ugly? So, you know, what can we do to make assistive products much more friendly and inviting for older people to use, and so on? I mean, probably I don't need to sit here telling you about what age sensitive means, but we would like to hear more about what that means so that we can unpack it for our audiences. I hope that kind of answered where we're sitting with that. Yeah, it's really important.
Kylie, you've moved right into you mentioned around the consultations of development of this roadmap on improving access. Can you share more around other areas that might have emerged that you're hearing about, questions that the WHO team might be wrestling with coming out of these consultations?
Yeah, that one, I think, to be entirely honest, we've got the reports sitting there, and at the moment we're really trying to synthesize so much because we heard a lot on the topic of aging and older persons. Older persons and assistive technology. But I think a couple of things that are really coming to mind is one, this sort of age sensitive and becoming much more explicit about what we mean, and really making sure within the roadmap that the older person is not an afterthought when it comes to government's planning and implementation of assistive technology services. And to be honest, it often is. So there's that. I think another thing that was coming out was around the concept of gatekeeping. And this is about, and perhaps it's more relevant in high-income countries where there are established services for assistive technology. But there, what we see is the barriers around older people being able to access the products that they need. But to do that, they need to go through a series of service providers. And it's really hard to access, for example, a walking frame without having an appointment with a physio and then, having then the training that you need to use it, etc. It becomes a complicated process, and it doesn't really need to be. So what we want to see is how can we make those products that are relatively safe to provide more readily available with less hoops for people to have to jump through in order to access them, and how can we bring them closer to the primary health service level without losing some of the precautions and safety that we need to be considering. And I also know that many people in high and low income countries go straight to the local pharmacy to buy those kinds of products. And then they're getting them with absolutely no support and provision and information on how to use them safely and so on. So we need to find a happy medium. We need to be able to protect and make sure people are not going to be harmed, but we also need to not overdo that so that it's just too hard to be able to get the products that are needed. Honestly, when I think about, my dad was stuck in hospital for 3 weeks, and it took 3 weeks to get him out. He was ready to go 2 weeks before, but it took me that long to get a wheelchair provided for him. And that was only possible because I fast-tracked it. I did the assessment myself, although I'm not registered to do that in Australia. And I had a colleague that signed off on it, so that was only possible because we really kind of pushed and made it so. And in that last week, he developed 3 pressure sores that he had with him for the next 5 months before he died. And that wasn't necessary, but it was just so difficult to get the services that he needed. So we need to do better, really do. Yeah.
Thank you,
I
Kylie.
think stigma would probably be the other theme. Sorry, out of that,
Yes.
those
No,
themes that were
please.
coming out, I think stigma and awareness are really key. But I would love, Sylvia, you ran those sessions and brought all of the speakers together, and you've drafted the report. So I would like to know what's coming to the surface for you in terms of, learning from that consultation and what you think is really important.
Thank you, Kylie. I think you have summarized excellent. I would like just to add the issue of co-production and the meaningful engagement of older persons, not just to get feedback after they are already users, but also in the development of products, but also in the development of policies, to be engaged in the whole process. And that relates to what you said about, not to be an afterthought, but including in the engagement in the development of the processes. And another issue is exactly together with the age sensitive, WHO uses age friendly, which I think everybody here would use, but also to add to that the age inclusive, which that also brings together those points.
Well, thank you both, and I would invite everyone here for your reflections on access and the direct access question, and as well as the co-production comment. I think that was really excellent. Now, there are a few mentions in the chat. I'm going to try to bundle them together. Is really around access for low, perhaps middle and lower income settings, and perhaps there may be something that you have seen around the urban and rural differences in access as well. There's some great comments around walking sticks and how people have been using them, and your family members are using walking sticks with FM radios on them. It's really fantastic. And on the other hand, we have a question around how can people access on the more technologically complex spectrum, things like social robots. So could you comment on sort of that spectrum of technology and the access?
Yeah, interesting. And you can tell from the examples that I'm bringing that I'm really focusing in on the lower middle income countries.
Mhm.
And a lot of the work that we're doing is focusing on the basics because they're just not there. And there is a huge amount of growth in technology being used to support older people. And that is mostly happening in high income countries. And, social robots, for example, there's work going on that. And from our perspective, it's like go for it. And as long as, but please do make sure that it's age friendly, and the co-production part of that is really important. So, is this really what an older person would see as the priority? Is this a need that the older person is expressing, or is it an idea that has come from a young innovator who's thought of a really great idea and is wanting to take this to market? So challenging yourself as an innovator in that technology space to really understand what the priorities are. And from my team's work, really it's like go for it with the technology. It's fantastic. Make sure it's age sensitive, but that's not where we're focusing the majority of our efforts when it comes to digital technology. Rather, on the digital technology space, I'm really interested in how we use digital technology to improve access. And so that's things like online platforms for information. The TAP platform that we've already talked about, having videos on there that people can download onto their phones and can use as a way to get simple information about simple assistive products that are in many people's lives. How do we use digital technology to improve the procurement and the supply chain for low-income countries that are now starting to move into digital technologies and apps not apps, platforms to manage medicines procurement and tracking and distribution across the country? Can we integrate assistive technology into that? So that's kind of where the focus of our team is when it comes to digital technology. Digital screening tools to do a really quick refractive error assessment. These are really the things that can really help and have an impact in low and middle income countries as well. When it comes to the actual products, to be honest, the funding that governments have to support people in their country to access the products they need is not going to be going to digital products as such, or technology accessible homes, safe houses, those sorts of things. It's about making sure that those that need a walking frame have got one. Those that need a toilet chair, I know this really distresses me. Older people in lower income countries who are unable to squat anymore to a squat toilet, they need a toilet chair and they can't get one. They can't afford it. So then you have the indignity of not being able to access the toilet yourself. And, we need to be able to do something about that. So that's where the focus is for our team, really, is to really help address the basics.
Thank you, Kai, putting that into focus for us. Sylvia, I saw your hand as well. Would you like to add to that?
I think Kylie brought it in, but just one short comment. Needs and preferences need to drive the development of technology and not the other way around. So
Yeah.
the fact that robots exist doesn't mean that we all have to have them. And again, when the funding goes or promoting innovation, it does not necessarily have to be promoting high-tech technology. It's promoting social innovation on what really serving the needs and preferences of older persons.
Thank you, Sylvia. I think that really brings to the fore what you were saying around co-production. It really needs to be, older persons need to have meaningful engagement and voice into this process and into what they need, what they want, what will benefit them as well. Fantastic. Well, thank you. Kylie, I want to, we're sort of winding down our time together, but I want to make sure I ask you, what can we be doing? What can the people on this call be doing to support in the advocacy, in the work that you're doing? Particularly, I think there's a lot of interest from our participants today around low and low middle income or income groups in countries, but also across countries in terms of the access to assistive technology and to support the work that your team is doing.
Mm. Yeah, I mean, I've talked a little bit about stigma and awareness, and I think that that is something that, you know, I would love to hear more from your members, what you think about this issue and what can be done. You know, how do we make assistive technology exciting and something that is empowering, not something that is seen as showing that you have a weakness, but rather by using assistive technology, you are empowered to be able to continue to do the things that you love. And how do we get that message out? And I don't think it's people my age that need to be the ones championing that message if we're going to get it across to older people. I think it needs to be older people who really believe in this and want to be able to share that message with their peers. I'm very happy to do it in 10, 15, 20 years, but I think I'm too young still to be the person that's leading that. So I really encourage people on the call, if you are using assistive products yourself, or if you really feel that this is an important issue, maybe that's something, Sonia, that we can work further on together around maybe a campaign that IFA might want to run, and we could run a joint campaign together. But I would love to see it being powered by people who are over 60, who want to get behind this as a core message. And honestly, we need that. We need help to really convince all of the stakeholders involved that older people care about this issue and really want to see access to assistive technology being improved equitably across the world. So the more that you can do, the better it helps us to be able to do more. So it's a nice, happy arrangement.
Yes, how can we make assistive technology fun and popular? We
Yeah.
have fashion show ideas with ideas that are starting to come.
Yeah.
Mark, maybe we can have your father demonstrate his
Oh,
use
wow.
of the walking stick as he brandish it with flourish with it. That I think those are fantastic things that we can showcase around the world.
Love the fashion show idea.
It would
Brilliant.
be fantastic.
Yeah.
We will come back, Kylie, for a closing word, but as always, we want to invite you to our next Global Cafe. We have Miss Queenie Mann, who will be joining us to talk about nourishing elders, enhancing well-being one meal at a time. So the idea around nutrition and how that impacts our health, which, as we all know, is very, very closely linked. So please join us and especially join us for the next 3 weeks because Global Cafe is taking a break for the summer. As we lead up into the global conference in South Africa, which I hope you are all coming to, it is a nice time for us to prepare for that and also to just give everyone a bit of a looser schedule for the summer months. So you don't want to miss our time together over the next 3 weeks. Please join us. And Kylie, back to you. Looking ahead and just around both a reflection of our conversation today and then looking ahead, what can we be doing together to accelerate equitable access to assistive technology?
Hmm. Look, I think we've already touched on one of those big things. You know, let's work on improving the PR around assistive technology as being something that people want to have. It's not that they have to have. So, you know, I think that's a really great way to start. And the other area that I would really like to see is challenging a little bit the status quo on the service delivery on assistive technology. So that issue of sort of gatekeeping that I spoke about, bringing assistive technology more into the conversation around a lot of those services that older people are interacting with. So, you know, primary health, aged care. I think they're kind of the big ones, really, is just it should become part and parcel of a conversation that any service provider is having. You know, do you need any support in a particular area? Oh, well, that's something that maybe an assistive product might assist you with that. Are you interested? To have that kind of conversation and then to be able to do something about it. It doesn't have to be as complicated as for some reason it is. I think probably one other massive wish that I have, and something that we are going to do some work on with a couple of other partner organizations this year, is around specifically the issue of wheelchairs. And this is something I have cared about passionately for years, is older people, when they are prescribed a wheelchair because of functional decline, usually it's a very poor standard transport wheelchair. It is not designed to provide good quality postural support. And it's considered to be, well, look, this is just something that will get you from A to B. But we know that once you start using a wheelchair, you might start to spend more and more time in that wheelchair. And it needs to fit. It needs to provide good postural support. It needs to have a cushion. And you need to feel comfortable in that chair. You don't want to feel like a sack of potatoes that's been dumped into something that's too big for you, doesn't have the right supports. And that is something that, again, love to get, you know, something we could do a survey on in order to build more expertise, you know, more information from older people themselves, because that helps us. And then even to put ideas out there around, well, what can we do to change the mindset of those that are providing wheelchairs for older people, so that they understand that just as you would for a younger person, you need to be able to make sure it fits and is comfortable. So that's a little passion project of mine, and would love to talk more about that one. And also would love to hear if people agree with me on this. So that's it, Sonia. Thank you. Thank you.
Kylie, thank you so much for your time, for your passion that you bring to this work. It's very inspiring and really so wonderful to learn more from you, both about the work that WHO is doing, and also so great to hear the ways in which we can contribute and we can be part of that process. So thank you so much, Kylie, for joining us. Thank you, everyone, for your time today, and I look forward to seeing you next week.
It's been an absolute pleasure. Thank you. Thank you very much.
Have a lovely weekend.
Bye.